All right, we got a bridge today. So we're gonna get everything designated within InLab. Just getting all of our ducks in a row here. Let's load and let me look at that. Oh, let me look at this picture here. It's gonna be an MTL bridge block, one of the METI. And let's do A2. A2 bridge block. All right. So administration's designated. Let's go to trim our models and show you pre-operatively. It looked like this. So we see the patient's missing a tooth. She did not want an implant. And so she has elected for a bridge. This is where we come in. Trim the opposing. Her bite is not great, but we've got a pre-op image. So anything we make, we can make it live within that old framework of what she's used to. All right, model axis. Put our blue dots on the teeth that they belong to. It says draw our margin. Looks like our computer did a lot of that for us. We're gonna help it some. Go to 6. Same thing. Okay. Our insertion axis is going to be our path of draw for the bridge. So ideally parallel with that neighboring contact and then reducing as many undercuts on those abutment teeth as we can. So apply, check for undercuts. Maybe we can come forward just a skosh. See what that does. Just gonna play around with this a little bit until we can get something that looks good. There we go. That I'm happy with. Spacer is 120 microns because we want to bond. We're going to apply for all of those abutment teeth and click OK. Check to make sure that transferred. It did. Let's just get a proposal. We may go back to positioning tab, but we'll see. Let's just see. Not a terrible starting spot. We got a little bit of work to do. See where we were. Right here. Okay. We can work with that. Yeah, remember that. So let's go through, fix a couple of these problems so that comes out a little bit. Same thing here. It's going to come out some. Put our opposing arch on. Form remove. Better. Good. Let's give her a little more occlusion here so I can see she's starting to have just a little bit of touch on this. Right? Let's bring that to a double turquoise. Maybe we even bring this cusp up a little bit. There we go. Let's see where her old tooth used to be. So is that something we want to do? Do we want to give her more tooth than she used to have? I think so. Because I know that before we did this, her bite was just a little open there. And so having it closed is going to be better for her. So let's take that off. Worst case scenario, I can always adjust it. So if it's too much for her to handle, I'll just polish it off. All right. So that looks good. We do need to change our Pontic. So we're going to edit the baseline of our Pontic. And let's make this more of a, so I think the inside's probably fine. Let's see, I may not change it. Let's see. Actually, not bad. Let's go back to editing our baseline. Do we want to change this any? Got a little bit of a ridge lap there, but that's okay. It's going to help hide that Pontic. So that looks good. Start working on our connectors. So we're going to use this shape circular tool to increase the size of this connector. So shape circular. Start to bring that out some. Let's go to 5. That distal 5. There we go. Now it's happy. All right, then we're going to start to do the same thing on 6. So our connector we want to strengthen. Go here to our Pontic. Shape circular out some. See where we're at. 11's definitely enough. It looks like it wants 12, which is a little overkill, but we can do it. All right, let's get those other teeth back on. That's going to be an issue. So we'll use our smooth tool. If we can't seat the bridge, it doesn't matter how strong the connector is because I can't seat it. So we're just gently removing some of this that's too tight. There we go. Just making this connector look pretty. You don't want it to look goofy. All right, now let's also add a little bit of occlusion on that Pontic. So she's paying for another tooth. We better make it so she can chew on it a little bit. Okay, we are getting close to being done. A nice little bite on that side. We reduce this tissue contact just a little bit. I want some green here. I want some kind of tissue contact. I just don't want all of that red. I'll contour that a little bit when it comes out too. So a little bit of a ridge lap, a little bit of that positive tissue pressure. Contour it just a little bit when it comes out. Copy. May bring this down just a little bit more for a little bit of a cusp tip here. Go back with this little smooth tool. I'm gonna drop that strength down and blend this in. It's not sticking out, looking goofy. Better. We should be getting really close. Let's check our articulator. So what happens when she moves left, right, forward, and back? Let's see. Remove. That's got to go. That's got to go. Better.
I made that.
Okay. There you have it. That's what our bridge is going to look like. Should be pretty. Appreciate you watching. I hope you have a great day. Till next time.